Hey everyone, welcome to another edition of EdTalks. I'm with my friend Tammy Hager. Tammy, welcome to EdTalks.
Thank you for having me, Ed.
Yeah, this is gonna be great because not only are you unique in terms of my typical guest, but you've also written a book, and I love fellow authors and kind of sharing the joys of birthing a book. So, Tammy, before we get started, tell everyone about you. Like, tell us about your career.
Sure. I'm a little unusual in that I have an operations background that really turned into a recruitment background. A lot of years working in health systems. I've worked for different job boards across the country. I currently work, and it's actually my favorite job of all. I'm the chief operating officer for a urology company where we go across the company. We actually provide urology services to healthcare systems, hospitals, and in a way that locums companies don't do it because we can actually make sure that we take care of the patients in the community. It's not just filling slots, it's providing continuity of care, running the entire programs, working and partnering with those systems to make sure that they're meeting their numbers, they're generating revenue, but truly taking care of those patients in the community. So that's really kind of how I've been doing this for more than 30 years and just kind of thinking about healthcare, how I grew up in West Virginia, the access to healthcare was tough there, knowing some of those communities. And it's just like, how can we do things differently? And I've always been a bit of a different person in organizations. I like to think differently. And how can we approach things differently? And then this book just kind of came about this past year. It took me about 4 months to write it. I give credit to all of the people that I've worked with over the years, the great physicians, my family. They live, eat, and breathe operations and recruitment. They've done that with me for years. So I am this crazy person that they live with. But I'm really passionate about how do we take care of patients in our communities. And the first thing that we need to do is think about how do healthcare systems, hospitals, and physicians really fit together to make this happen.
Yeah, no, I love that, and I appreciate the passion that comes through. But before we get to the book, my audience would be mad at me if I didn't ask you a recruitment question because you, as you shared, you've done a lot of recruitment across the years, not just with physician side, but more generally in healthcare. So, what is one thing? Because I get asked this all the time, but you're a better position to answer it. Like for a mid to senior level person, and they're thinking about, hey, I should probably change jobs. How should they work with a recruiter? And they should do it proactively, right? Not to lead you on your question, but tell us a little bit about like what recommendations would you give?
So there's probably several things, and depending on what they're looking for, if it's a physician or a layperson, the first thing they need to do is understand, do they want to move? If they don't want to move, sometimes that really limits you. They need to understand the type of organization and the type of environment they want to work in because organizational health is so important. And you think of all the burnout and everything that goes on across the country. When you're looking for something, I would do just a lot of research on the background of these companies. You can talk with recruiters inside those organizations without having to talk to search firms, but
Yeah.
do your homework ahead of time and also make sure if you have a family, what are their needs? How will they fit into the communities? What's important to you? And make that list. You've
Yeah.
got to do the what's important to me and my family list so that as you're going into this, you're not going to find everything that's perfect. But if you're there 85 to 90% of the way from your list, that's when you're going to be successful. So reaching out to those organizations specifically is a great way to do that. It's also good to network with folks that are like you. So if you're a physician and you're a urologist, call a urologist that you know, that people know who can actually really give you some good advice and some mentorship on the places that they know that are great to work.
That's awesome. That's a great bonus content right there. So let's talk about the book, the physician recruitment playbook. So tell us why the book. It's amazing you did it in 4 months, pretty fast. And what are one or two things people might learn from it?
Yeah, definitely. So when I think about organizations, healthcare is actually built on people. And when we think about physicians in those organizations, if we did not have physicians seeing the patients, generating the revenue, there would be no hospitals and no healthcare systems. So it really is, how do we focus on bringing the right physicians who are the right fit into those organizations to help not only grow the organizations, but to really provide the care in the communities where they live. And in doing that, it's like we got to go from being transactional to being relationship based because everything that we do can't be a transaction. And that's what physicians remember. The people who actually do recruitment well are where they're going to want to end up because they're beginning to learn not only have they done their homework, but as they go through the recruitment process, they really learn the organization, the people, what they do well. If it's a smooth recruitment process, pretty much once they start to work there, it's going to be a smooth employment process. But when they find little hiccups along the way in their recruitment process, they're going to have to get a second thought. Is that where I really want to be? So there's a lot of nuggets in this book, but it really goes back to relationships. And then also thinking about recruiters, a lot of times they aren't trained to do recruitment. You could be an administrative assistant, and sometimes in these small hospitals, it's like you're tagged, you're it, you're doing recruitment. So no experience. So it's like, how do we elevate the recruiters to be a part of the C-suite team? Because they need to be brought in at the very beginning of conversations of, these are the physicians that we need that will help us sustain and grow our organization. And how can the recruiters be a part of that planning? Because they need to know where these physicians are, where to find them. And it's not just a matter of posting a job and praying they're going to apply. It really is, especially specifics like urology that I work in. It really is a one-on-one type of recruitment that you do. And you've got to know where to find them, and you've got to be able to have those good relationships with those people.
That's awesome. So yeah, it's great. It's a handbook, a playbook. You can, if it's something that you need help with, this is a great resource. Or even if you're pretty good already, it might still give you a couple little bonus items in there. So Tammy, what's the best way, easiest way to find the book?
It's really easy. Amazon.com. You can go to my LinkedIn page. I've got lots of stuff going on LinkedIn, but it's an Amazon. It's really easy. You can read excerpts on there, or you can read part of it for free. My goal is, it's a very niche book. And when I published it, I knew that, but I also know that across the country, the turmoil we're in and not enough physicians, how do we get this to everyone? There's checklists in the back of when you actually go and purchase it. I'm going to be posting some things on LinkedIn next week. I have a website they can go to where they can print off all the PDFs that they want to have access to. So we'll be able to have that for people as well.
Yeah, I love it. Super practical, not just theory, but it's like, hey, these are action items. You got checklists, all that kind of stuff. Tammy, thank you for being a guest